Just to get it out of the way, the first question that came in is, what is microneedling and what are its benefits? Microneedling has been around for quite a while, and it usually is a device. It looks like a pen or some type of machine with lots of little needles on the end. This is intended to be applied to the facial skin, either in a gliding motion or in a stamping motion, and these hundreds of little tiny needles poke into the skin at varying depths. And usually this is something that we can control, whether we want it to go in 0.1, 0.2 millimeters, half a millimeter, 1 full millimeter. Some devices, depending on their settings, may even go up to 2 or 3 millimeters in depth. Now, as these tiny little needles penetrate the skin, you may notice a little bit of pinpoint bleeding if they're going deep enough that they're getting to some of the blood vessels in the skin. The needles are so small, however, that you're not generating enough of an injury to cause true scarring, but it is enough of an injury to stimulate a cascade of healing response in the body that you generate new collagen, which is often going to be healthy, more youthful appearing collagen. So a series of microneedling treatments may help to improve the look of fine lines and wrinkles, and in some instances may help with some discoloration or pigmentation if you've been battling that, depending on the type of skincare products that you use in conjunction with your treatment. So in general, microneedling is a treatment that uses tiny little needles that are inserted all over the skin due to this little motor in the pen as you sweep it around the skin, usually because you have a gliding solution of some kind, and that little injury generates new collagen to improve the texture of the skin. Most microneedling treatments have very little downtime, which means the results are also going to be modest. So you shouldn't expect huge laser-style results from a device that is only giving you a day or two of downtime in most cases. The next question is, can I combine microneedling with subcision? Now, subcision is a treatment that we don't do quite as often, but for the right type of scar, subcision can be great. So when we have scars that are tethered down to the underlying structures, so we have like a scar tissue band that goes from the skin down to the fascia overlying the facial muscles, that little tether can really create quite a pockmark in the skin. And no matter how many times you microneedle over the top, you're not going to be releasing that band that is tethering the skin down to those deeper layers. You're always going to have that dimple. What we do with subcision is we usually will numb the area with a little bit of lidocaine just next to the area where that tethered band is present. Then we take a specialized type of needle called a no-core needle. And these look pretty gnarly. You wouldn't want to use these for an injection of any kind or starting an IV because they're almost like an 18-gauge needle with a small blade on the end. And we'll insert that under the skin, and then in a sweeping motion, we'll go ahead and slide underneath that tethered band of scar tissue and sweep and actually cut that tethered band so that the skin can release up off of that fascia and you no longer have that dimple in the skin. Subcision is something that should be done by a professional because it is using a bigger needle that is penetrating under the skin, so the risk of infection or bleeding does go up as compared to microneedling. But the question was, can you combine subcision with microneedling? And the answer is yes. So in the hands of a trained dermatologist, this is a procedure that could be done at the same time. You do just want to be careful that you're not increasing your risk of infection, so sterile procedures need to be followed, and you need to understand your aftercare. But if you're using microneedling as a way to help address acne scars or other types of scars, if you have the right type of scars, subcision could be a complementary treatment to that. How often should you do microneedling? This is a common question that I get in the clinic and online. And remember that when we're doing microneedling, we're actually waiting on the body to generate new collagen, and that process doesn't happen overnight. So even though you may have gone through a microneedling treatment and the skin has completely healed over, it's not sensitive anymore after 5 to 7 days, it still takes your body sometimes several weeks to months in order to really get the full benefits of that microneedling treatment. So your body may be producing new collagen for a period of several weeks to months. And so even if you don't see amazing results 3 weeks after your treatment, it might be significantly better 6 to 10 weeks after your treatment. Because of this, we know that it's important to wait an appropriate amount of time between your microneedling treatments. What I advise most of my patients to do is to wait at least 4 weeks between those treatments. We usually have a good idea how many treatments somebody will need, but we want them to start generating that collagen before we re-injure the skin. And I think, in my opinion, is that 4 weeks is the minimum amount of time that you should wait. But if you wanted to wait 6 or 10 weeks, you could, and you wouldn't be losing any of that benefit. And again, one of the most common questions that I get online, not necessarily in the clinic, is, can I do home dermarolling, and how does that compare to microneedling? Dermarolling is very popular, and there's a lot of devices out there. Sometimes it is called microneedling, but usually this is going to be on a roller, and it's going to be a wheel that has lots of little needles coming out of it. Almost looks like a spike wheel. And these needles are usually much smaller than the typical microneedling treatments that you would get in the office, and it's designed to be rolled on the face or over the hair if you're trying to use it to promote hair growth. And I'm not completely opposed to home microneedling or home dermarolling. I think there could be a role for it, but there's a few important things that you need to know if you're going to be using it. I've actually done a whole video on this topic, and I'm going to put the card for that up here so you can watch the whole video if you want. But some of the essential things to know if you're going to be home dermarolling are to make sure you're purchasing a reputable device, a reputable company making that, so that you're getting really good quality products that aren't going to be giving you allergic reactions due to cheap metals. You should always sterilize the tool before and after use. So you need to treat it with alcohol, and although I say sterilize, you're not truly sterilizing it, you're just essentially cleaning it, because if you're not putting it through an autoclave, it's not going to be sterilized. You also should generally select a device where the needles don't go longer than 0.25 millimeters. You don't want anything that goes deeper. I don't believe that home dermarolling treatments should be drawing blood. I think that increases your risk significantly. If you want to incorporate a home dermarolling practice, you need to be committed to purchase a new device frequently or to replace the head of that device. You shouldn't be taking the cheap way out on this. If you can't afford to replace the roller frequently so that your needles are always sharp, you shouldn't be doing home dermarolling. And lastly, do not do home dermarolling if you have any compromise in your skin barrier. So if you're dealing with active acne, active eczema, or, heaven forbid, any cold sores, I do not recommend doing any dermarolling because you could spread an infection around on the tool, especially with a cold sore, that herpes virus. You could carry that all over the face, and it could be catastrophic and create lifelong scarring. So in short, yes, dermarolling can be done safely at home, but there's some rules that you should follow. It's not going to deliver the same type of results as microneedling in the office, but it can be something you could do between your treatments as long as you're doing it safe. I have a favorite home dermarolling device. It's called Beauty Magnet, and I'll leave the link for that down in the video description.